Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to go over the best knee braces. So let me just start off by saying I'm not a big fan of knee braces. I find that people use them in lieu of actually seeking treatment, and that's not what they are designed for. So anytime you rely on a brace as opposed to treatment, it's not really the best course of action. However, they can serve some purposes, especially while you are seeking treatment. They can help a little bit. So let's talk about, we're going to kind of talk about a little bit of all of them. So the first one I want to talk about is just that knee strap. So the knee strap just goes around your knee right at the bottom. It's just a simple one little loop strap. That's designed to take some of the pressure off of this tendon at the bottom of the kneecap, what we call the patellar tendon. We see this a lot in like a runner's knee, a jumper's knee, because of the tendonitis. It's usually trying to unload some of the pressure that gets put on the knee and allow that to be dispersed elsewhere. Now this is really one that gets used in lieu of treating the problem. So while this can be a Band-Aid for a while, months, years, it's eventually going to fail because you do need to actually worry about why there's too much pressure on that tendon, and you need to fix that situation. Is it your foot? Is it your hip? Where is that pressure coming from? So again, strap, really good to take that pressure off initially, but make sure you're figuring out why you're having that pressure. Make sure you're getting that treated, because that's not a fixing all type of brace. The next one we're going to talk about is just a simple knee sleeve. So this is just the one that you just put on. It's generally neoprene. It squeezes the knee a little bit. Pretty good for swelling, sometimes pain. Sometimes it just kind of gives your knee a little hug. This offers no real support. There's nothing really to this brace. An ACE bandage, basically applied the same way, can do the same thing. So be aware that you're not, again, getting any support from that, but it does allow you to have some reduced pain at times, and it can help some swelling. Not replacing any treatment, not replacing therapy again, but those days that you're really, really sore, you can certainly put that on and it can help reduce some of that pain. Now we're going to talk about the ACL brace. So the ACL brace is something you'll see a lot of athletes wear. Somebody who's torn their ACL, it's got two metal pieces that come up the side here, and then there's straps. Apparently my balance is terrible. And then there's straps above the knee and below the knee. This is a very supportive brace. So it's designed to help the ACL out. It's designed to stabilize the knee. And it is really important that you wear this correctly. So most people who have this have gone through surgery or are going through surgery or have been through treatment. This is not an over-the-counter brace that you can just pick up, but it's something that, you know, if you wind up just putting one on, you want to make sure that it is applied properly, because it can slide down and not stabilize the knee as well. Again, those are used post-ACL, maybe an ACL tear. You will put that on, but it's designed to help stabilize the knee. But you don't want to, again, replace therapy and just rely on a brace for anything. Then you have kind of what we call an unloader brace, which actually has just metal on one side of the brace. That's usually designed for people who have some sort of knee that's going in or going out. It's designed to help really apply pressure to the side of the knee that needs the most stabilization. These are really the most functional braces. These are the ones that I will say probably not going to get around not wearing this. This is not a substitution for treatment. You're actually going to need to wear that sort of brace to correct your walking, to correct your standing posture. You're not really going to get around it. So these are braces that you wear when there's true structural deformities going on. The knee is really grossly out of whack, and you really need that metal on the inside and the outside of that leg to help you stabilize that leg. So those are just a quick rundown of some of the more popular knee braces. Of course, there's a bunch out there. There's some copper, I think, and different things like that. But those are the four, what I would say, basic knee braces that you're going to find. All different manufacturers, but those are really just what we usually see in the clinic. Like I said, I don't really recommend anything to replace treatment, but if you want to use it along with treatment, they absolutely can help. If you or someone you know is suffering with knee pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.